With Premier David Makura of the Gauteng COVID-19 site. Let's go there live.
Different testing kits, especially the rapid ones, which we are guided by our health group of scientists about that under the leadership of the MEC for Health and the HOD for Health, Professor Lukele, who is waiting for us at Charlotte Maxeke. We're always guided by them on what the next phase of testing is. So after that, we've got, how many patients do we have in our hospital currently? We've got okay. We've got 58 patients admitted in our hospital. 18 of them are in our public hospitals, and 40 are in our private hospitals. You would see they are, so under different, those under ventilators, you would see there are 7. So they are in our ICU and high care wards, and some are just in general wards, you would see. So we have a full breakdown of that. So that's the total number of admissions is ever since. This would be ever since we had admissions in our hospitals, but the current figure now is 58. This excludes yesterday. This is as of the day before. Bed availability. This is a very important slide for us. So firstly, we give you an indication of our conversation with private sector, with the private hospitals in our province. Out of the 19 licensed private beds in Gauteng, 19,237, 6,805 will be made available as per our discussion and agreement with them for COVID-19. In the next slide, we're going to share with you how many. So this is just where we are now with regard to the public, but the next slide will tell the better story about the beds in the public sector, how many beds we will finally have. Okay, so this, I'll deal with this in detail later. Where is that? Okay, this. Okay, so the total number of beds as we will have, the general beds would be 6,354. The ICU beds will be 1,665. The high care beds will be 393. We often add ICU and high care. That would give us close to 2,000 beds. So in total, we've got 8,012 beds. This is where we are now, because it's a slide, I think when you prepare these presentations, there's a slide that they took out. Yes, do took out that slide, which shows, unless if it's ahead, which shows how many more beds we are putting in our existing facilities, as well as in places like the hospital we have in the West Rand. That's been, in a sense, it's an Ashanti. It's a mining hospital there. So that slide that I put a good summary of that on that. Now this is quarantine. I think often in public there's also confusion around beds. That's beds, ICU and high care beds. That's hospitals and facilities where people are being put because they are in quarantine or in isolation. So this facility where we are, and what we're going to be showing you is for isolation and quarantine. We have many places in Gauteng, the ESCOM Training Center, the Transnet SLN Park School. So there are public sector places in Gauteng, including some of the hotels that are being used by both the province and national government departments to put people in quarantine or in isolation. Doctor, am I correct that in isolation is those who have tested positive? But quarantine is people that, like us, you're isolating from family, because there's work that you are still doing. You're not quite sure about their status. You just want to be sure that they don't live amongst others and they infect them. So this place where we are, so what we are going to be showing you is not the part of the hospital. It's the part of quarantine and isolation, so that that is fully understood.
Are we in quarantine now?
We possibly are all in quarantine. We will see where we are going to sleep when we are in quarantine. And the quarantine is for 14 days only. Because after 14 days, Dr. Masuku will indicate what happens with the integration of people. Or now we have the results, we know you are positive. When you are positive, you are now put in isolation. Or you are negative, you are now released. We need to report that there are 44 government officials and not provincial government only. In the whole province, we have national government departments. 44 government officials have tested positive. 29 of them are our healthcare workers. They are amongst our healthcare workers. 3 are from different departments of the provincial government. 12 include national departments, including the police, and the Port Health, the health workers who were managing, especially OR Tambo. When the airport was open, they were at the coal face of it. They're included in that. We have 14 workers in the private health care workers in the private sector. Healthcare workers in the private sector who have tested positive. 12 are from Mediclinic. And 2 are from RVAPE. RVAPE is in Ekurhuleni, the Mediclinic that is in Sandton. That is a Morningside clinic. And then we've got other workers who have also tested positive, particularly retail workers, 47 of them, 1 Checkers, 24 Discam, Unilever employees as well. I think the point we're making there is that our surveillance system is to also make sure that even with those workers, we interested about the contacts they have had and those who need quarantine and isolation. We don't just leave it to the private sector to take care of it. We've got a big army of community health workers, 8,313 who have been trained. They are the ones who are supporting us in this battle, especially to go out to communities in that way. So, on health, Mr. President, the big thing we are busy with is preparing the infrastructure, like the infrastructure we are at today. I want to emphasize, our approach is that we must spend more resources on increasing the number of beds in our existing hospitals, so that we don't build structures that will be raised down post-COVID pandemic, post the peak and the big wave. We are expanding existing hospital capacity to bring in more ICU beds, high care beds, as well as general wards beds in this. And this is something we were going to do over 5 years. We have pulled it back. We are doing that particularly in hospitals that are under pressure in the different parts of Gauteng. The second thing is that we have cleared some hospitals in Gauteng, such as Tshwane District Hospital is declared a full COVID hospital. We are also clearing Bethaqoa in Germiston, which will also, we are moving the patients to other hospitals. We have done the same at Tshwane District. So Betlatowa in Ekurhuleni will be a full COVID hospital. We are doing that. And in each of those, we do lots of infrastructure upgrade, which is done by the Department of Infrastructure Development. Because beyond COVID, we want the structures to remain serving our people. We are using alternative building technologies so that delivery can be done much, much quicker. But these structures will be durable structures that will last longer than 20 years or so. So that's our approach. Food, I'll be very brief on the food side of it. You have been concerned about food distribution in Gauteng province. So far, we have distributed 33,632 food parcels to households. So that's the number of households that have received food parcels. We are working with the private sector. Food distribution is one of those areas where we have this social activism and social mobilization, social compact and social partnerships and social solidarity. The average household size is 5 people, so we have reached over 160,000 people so far. With every day we distribute about 2,000 food parcels. And I want to say in Gauteng province, food is not being distributed by councillors or members of parliament. So there are no politicians who are distributing food in Gauteng. Food is distributed by the food banks. The food banks have social development officials who work with social workers to identify food insecure families so that the food can go to those families. So there's no political influence over who get the food. It's just based on who is needy. And that's the emphasis. When you go to the Johannesburg Food Bank, we will find MEC Lisufi there, who will just give a brief how we receive food, where does it go from there, how does it go to the household. There's also no queuing in Gauteng in the distribution of food by government. I want to say so because the queues we see on media are good Samaritans with good hearts, but they don't know how to distribute the food. So they get into communities with trucks, and then the long queues happen there, and there's lots of commotion that happens there. They are doing a good work, but we have been advising them that if you just do that, you are going to create problems. There's indignity there about the way our people are getting the food. But we must tell you, food has not been enough. In fact, the number of people who are food insecure is twice the size of what we had earlier on measured using our agencies like Statistics South Africa. So we need lots of assistance. I think the intervention you have made as national government will be helpful. We also support your idea of the e-vouchers. So we are now piloting. So even though we have the food banks, we ourselves are concerned about buying and sometimes the fraud that may happen, pricing, problems with pricing. We also support the idea of the voucher, where a family will decide what to buy and how much to buy and where to buy. So we are piloting that. So MEC Lisufu will give us a briefing there on the piloting of food vouchers. The rest is a detail of the heat map. Where do we have higher rates of food insecurity in different parts of our province? Mr. President, this is something that we can't go through now. We also, in addition to the 33,000, we're also taking care of the homeless. So they are in their own shelters. The number I gave you does not include them. So every day we provide food to 3,000 or so homeless people in their shelters, but the number is dropping. More homeless people are leaving those shelters. If you ask for where, we don't know. They are leaving those shelters. We started with a huge number. At some point, we had 15,000 people. Now we have 3,000. And the reports from our municipalities is that every day, there are fewer and fewer numbers of homeless people who are there. We are working out a strategy to deal with homelessness beyond COVID, so that we don't have to come when there is a crisis only. So we are developing a strategy to address homelessness as a province coming out of this. I have already spoken about social mobilization. I don't have to go into the detail now about that. We are working with the national human settlements. We have identified areas that need decongestion. Tshwane and Johannesburg have been identified, including Ekurhuleni. There's land already identified for decongestion. We are sorting out the infrastructure related to that. We will resettle 5,892 households in Tshwane alone, including the people who had a problem of the floods. They are included in this number who will be resettled. There's more details that we have about our interventions in various areas on human settlements. I don't want to take more time on this. It's a detail that the presidency has through the National Command Center. Lots of work done by our law enforcement agencies to ensure compliance, but also just to do normal law enforcement. When we talk about the number of arrests, often it's not people just arrested for breaking the regulations, but for crime. So we have Ukai Mulao. Ukai Mulao operations, roadblocks are conducted by the police outside, in addition to the regulations on the lockdown. They are doing normal policing. Crime rate has shot down in our province in a very big way. But we had problem of school crime about break-in in our schools. Police have arrested more than 60 people already related to that. So we give you the full numbers here about enforcement and how many vehicles. I think it's a matter that we will continue to share with the media, with yourselves. We have also been concerned about incidents where law enforcement officers have gone beyond the bounds of law and have been giving feedback to our provincial commissioner, who works with all of them, coordinates all of them, to always go back and talk to them, because to say to them they must do things within the bounds of the law. And he's been doing that continuously. Some of the key area of police activities around shebins and the illegal sale of liquor, alcohol. So there's been lots of backdoor sale of alcohol in many, including by big corporates, by the way, distributing alcohol. One big corporate company is currently in court with us, with government, because their trucks were, the police actually tracked them down and traced their trucks who were distributing alcohol in different areas. They were tracked down. But there's also lots of other things that are happening the police are telling us there's lots of brewing of alcohol, home brewing, including Mbamba. I don't know what is Mbamba in English, but you know Mbamba from Shawela, President. It's Mbamba. There's lots of initiatives to do home brew stuff, and the police sometimes crack on this home brewing. And we listened to you yesterday. You said the ban on the sale of alcohol continues. So there's going to be a lot of police activity again there. And that's really the long and short. This is the work of our command center, guided by the National Command Center. We will talk to you. I've spoken to you privately about where we need your assistance. But Gauteng started with huge numbers as the epicenter. We are still the epicenter, together with the Western Cape. We are doing everything to make sure that we can contain the infections and the spread. Particularly, of particular concern to us every day is to watch the high-risk areas. The high-risk and high vulnerability areas are the informal settlements and the high-density townships. So our tracing teams and our surveillance teams are focusing in particular to ensure that in those areas we try to track everybody. Once we have one case, the contacts in those areas, because we know what the negative, the huge impact it could be on that. So far, our command team, our command council has been doing a great job, and I want to commend our health workers and our health specialists. So we've got a team of health specialists who do modeling for us. Behind the scenes, you won't see them now. They are doing modeling for us. They bring that through the MEC for Health, who's himself a doctor, our HOD, who's himself a doctor. They bring that through to us so that we can make decisions based on science. So thank you so much. That's where we are now. If there is, I don't know, I think the president will not have a question. Over to you, Mr. President.
Well, thank you very much, Premier. This is most impressive. Let me commend you and your team for the really outstanding work that you're doing. I mean, we see you on TV in the field. We see you on the ground. We see you amongst our people. We see you going all over. And now I can see what is behind all that going up and down. So it shows that real work is being done, and it is most impressive work. I particularly like the fact that you have taken the whole issue of preparedness seriously. That you are preparing the province and the work that you continue to do, you're preparing the province for almost the worst case scenario. The tracing, I'm particularly impressed with the tracing, and I know that you're using technology, really good technology to heighten the tracing process. I heard it being explained to me, and now I know that it is a reality that you're tracing. But it is the screening that I find most impressive. That here in Gauteng we've been able to screen almost 1 million people is possibly the most impressive. We have said that it is through screening and tracing and testing that we will be able to defeat this invincible enemy, coronavirus. And I'm glad to see that here it is being done in real effect. But I also like the way that you have identified the pillars that are underpinning your strategy to deal with the coronavirus. It is most impressive. The care that you are showing in relation to food security, and I'm glad that you have also embraced the issue of the vouchers, because it is through the vouchers that we are able to reduce the sense of indignity that our people are subjected to, particularly when they have to queue for food. But the food banks are the answer. They are universal in many countries. Many countries use food banks. They are dignified, they are organized, they are well structured, and I am particularly attracted to the food banks issue. I like that. So thank you very much. So I think you're doing a great deal of work, and thank you very much for this exposition. Thank you.
So if I was just to, in the numbers of beds we have given you, there's 1,100 that's not in there because that's where the build program is. So there's the 8,400 is what is ready. 8,400, that's both public and private. And then 1,100 will be ready July, end of June, July. So, and most of that 1,100, 900 of them are ICU beds. They are deployed in our existing facilities to do expansion. So I am just explaining that 8,400 excludes 1,100, which will take us to 9,500 when we are done with the existing expansion. And I must say to you that we also think we can add here another 500 ICU bed. When we go around, you'll see. Should we go to that next phase, that's taking into account the worst case scenario, we can add another 500 beds here, which will take us to 10,000 beds in total. They are in 3 categories: it's general wards, it's ICU, it's high care in total. So that's our vision here. We are investing in expanding existing capacity. So thank you so much, Mr. President. I think MEC for Health, we can walk the President. MEC for Infrastructure, you will take over when we go there. That is your thing to show the President.